Each year, children in elementary school have hearing screenings. Typically, the school nurse conducts screenings to identify any children who may need more support for their hearing. The nurse looks at the results and determines what needs to happen next. Let's look at 3 different types of results and what happens with each. The child's results are in the range we expect. The nurse keeps the child in the rotation to be screened again at the next screening time. The child's family is told of the results. The child's results are in a gray area, not quite in need of a specialist, but also not exactly where we expect them to be. The nurse speaks to the child's family, and the teacher agrees to provide a little help, like sitting closer to the front of the class. The child will be screened again in a couple of months. The child's results show that they need an evaluation from a specialist. The nurse recommends that the child sees their pediatrician, who may refer them to a specialist, like an audiologist. The specialist can determine if they qualify for assistive devices and a plan for school. The same steps take place when children participate in developmental screenings. Developmental screenings can be done by a doctor or nurse, or by other professionals in healthcare, early childhood education, community, or school settings. The person conducting the developmental screening is similar to the school nurse who screened for hearing, only this time they are identifying children who may need more developmental support. The child care provider or other professional administers and scores a developmental screening for a child. With some screening tools, a parent or caregiver will be asked to complete a questionnaire for their child. The results are confidential and shared only with families. Based on the results and the guidance provided by the developmental screening tool being used, they will meet with families to discuss what is recommended next. Most children will be in the range we expect. They will be screened again at the usual interval. Some children will be in a gray area, not quite in need of a specialist. The provider or professional who administered and scored the developmental screening will meet with the family to discuss which skills they should practice with the child at home, how skills will be practiced in class, and then screen the child again in a couple of months. There may be children who have results that show they need evaluations from a specialist. The teacher meets with the family to provide the results of screening and offer information such as a copy of the results for the pediatrician and who to contact for evaluation. Specialists who evaluate developmental delays include early intervention, the child study team, or developmental specialist. That specialist can determine if the child qualifies for services. The specialist gives the diagnosis and recommends special education services, therapies, or other strategies. Those recommendations can make all the difference for a child's life because they focus in on areas to strengthen and how to provide the child with support. Whether it's a hearing screening or a developmental screening, the ultimate goal is the same: to make sure that children have the support they need.